Hey everyone, welcome back to Shock Doc Medical. This is your host, Dr. Rod. Today, I've got a real doozy for you. We're diving deep into the wild world of back pain. Now, have you ever wondered why back pain is such a massive problem that costs us nearly $200 billion every single year? And why it's the #1 reason people hit the emergency room? Stick around, because in this episode, we're breaking down everything you need to know, from what's causing it to how we can actually treat it, both in adults and kids. So grab your coffee, get comfy, and let's get into it. All right, so let's set the stage. Back pain isn't just that annoying ache you get after a long day at work. It's a complex, multifaceted problem that affects people of all ages. Whether you're dealing with a minor strain from lifting heavy boxes or chronic pain that just won't quit, there's a ton of factors at play. And the costs? They're astronomical, not just in dollars, but in lost work hours, reduced productivity, and even long-term disability. Today, we're going to cover the whole spectrum: the causes, the red flags, and of course, the treatments you can actually use. And yes, I'll be throwing in some real-world treatment examples, including medication names and doses where appropriate. Let's talk etiology. Basically, why does your back hurt? Back pain can come from a variety of sources, and it's usually broken down into a few big categories. Traumatic. Think whiplash from a car accident, strains, or even fractures. Degenerative. This is what happens over time. Intervertebral disc herniation, degenerative disc disease, you name it. Oncologic. Yep, sometimes back pain can be linked to cancer, either primary or metastatic lesions. Infectious. Infections in the back, whether through direct injury or spread from somewhere else. Inflammatory. Conditions like ankylosing spondylitis or sacroiliitis, where inflammation is the culprit. Metabolic. Disorders like osteoporosis that affect bone metabolism. Referred pain. Believe it or not, pain from organs like your gallbladder or lungs can actually manifest as back pain. Postural. Long hours of sitting, poor ergonomics, common in our modern work life. Congenital. Structural issues you're born with, like kyphoscoliosis. Psychiatric. Sometimes, back pain is tied to chronic pain syndromes or even cases of malingering. Each of these etiologies tells a different story about what's happening in your body. For instance, while 90% of back pain cases in adults are due to mechanical or nonspecific causes, it's crucial not to overlook those rare but serious conditions. Now, as much as we all want to chalk up our aches to a bad day at the office, there are certain red flags we have to watch out for. In adults, if you have a history of cancer, unexplained weight loss, or localized tenderness, that could hint at something more sinister, like malignancy or an infection. Think fever, a recent spinal procedure, or even a history of intravenous drug use. And for our younger listeners, if you're under 4 and you're having constant nighttime pain, or there's a history of tuberculosis exposure, that's a major flag. We also use some classic physical tests to pinpoint the problem. Ever heard of the straight leg raising test? We raise your leg from 30 degrees to 70 degrees, and if you feel pain before 60 degrees, it's a positive sign for something like a lumbar disc herniation. And then there's the crossed SLR, which is even more specific. We've got the Stork test for spondylolysis and the Adam test for scoliosis, where you bend over and bam, any abnormal hump in your back can be a clue. It's like detective work, but for your spine. Diagnosis starts with a good old history and physical exam. You want to know when the pain started, what makes it better or worse, and any other symptoms that might give you clues. If your back pain sticks around for more than 6 weeks in adults or 4 weeks in kids, then it's time to get some imaging done. We're talking plain x-rays, anteroposterior and lateral views, CT scans, or even MRIs if we're worried about soft tissue issues like disc herniation or nerve involvement. And sometimes, if radiculopathy is suspected, you might even get an EMG or nerve conduction studies. It's all about piecing together the puzzle. Okay, so you've been through the diagnostic roller coaster and now you're thinking, Doc, how do we fix this? Most back pain cases can actually be managed conservatively, especially the nonspecific ones. For adults with acute back pain, the first-line approach is to get moving again. Yep, I know it sounds counterintuitive, but early return to normal routines while avoiding heavy labor is key, and patient education is huge. Knowing what not to do can prevent a recurrence. Now let's talk medications, and here's where I like to get into the nitty-gritty details. For pain relief, NSAIDs are our bread and butter. For example, ibuprofen is commonly used, typically about 400 to 600 milligrams every 4 to 6 hours as needed, with a maximum daily dose around 3,200 milligrams. Then we have muscle relaxants like cyclobenzaprine, which is often dosed at 5 to 10 milligrams 3 times a day. For those rare cases where opioids might be necessary, say for acute radicular pain, you might see something like oxycodone IR, 5 to 10 milligrams every 4 to 6 hours as needed. But trust me, we try to steer clear of opioids unless absolutely necessary. If you're dealing with chronic back pain, we also look at non-pharmacological options. This includes physical therapy, sometimes using the McKenzie method, which focuses on manual therapy and exercises that strengthen your core and improve posture. Cognitive behavioral therapy is also a first-line treatment because, let's be honest, chronic pain isn't just physical, it's mental too. And then there's spinal manipulation, massage, acupuncture, and even yoga and stress reduction techniques. For pharmacologic options in chronic cases, second-line treatments might include NSAIDs, as I mentioned, or even SNRIs like duloxetine, which is typically started at 30 milligrams daily and can be increased to 60 milligrams based on response. And don't forget, diagnostics are key. If you have any red flags, you might need imaging sooner rather than later. For example, persistent pain beyond 6 weeks in adults or 4 weeks in kids warrants an X-ray or MRI to rule out serious conditions. Now, back pain isn't just an adult problem. Kids and teens get it too, though it's less common. In pediatric patients, the causes often differ. Overuse, muscle strain from sports, and even things like Scheuermann's kyphosis come into play. For most of these cases, first-line treatment is similar: activity modification, physical therapy, and NSAIDs. For example, for kids, we might use ibuprofen at about 10 kilograms per dose every 6 to 8 hours, keeping within safe limits. If a kid has spondylolysis from repetitive stress, think cheerleading or gymnastics, they're often managed conservatively at first. But if symptoms persist beyond 6 months, or if there's grade 3 or 4 spondylolisthesis, then it might be time for a referral to a pediatric spine surgeon. For Scheuermann's kyphosis, if the spinal curvature is less than 60 degrees, physical therapy and guided exercise are typically enough. When it's between 60 degrees and 70 degrees, bracing comes into the picture. And if it's over 75 degrees, especially in a mature skeleton, surgery might be indicated. To really nail down treatment, you've got to get the differential diagnosis right. In adults, back pain can be from lumbosacral strains or sprains, usually following trauma or overuse. Lumbar spondylosis, which tends to affect folks over 40. Disc herniation, typically affecting the S4 to S1 segments, with symptoms like paresthesia or loss of strength. Spondylolysis and spondylolisthesis, often from repetitive stress, sometimes radiating pain into the glutes and thighs. Vertebral compression fractures from trauma or osteoporosis. Spinal stenosis, where narrowing of the spinal canal causes leg pain that improves with rest. And even serious conditions like tumors or infections. In kids, the list includes some of the same culprits, but also things like a slipped apophysis, posterior arch lesions, and even idiopathic scoliosis, which is often picked up with a positive Adam test. The key takeaway? A thorough history and physical exam usually give us the answers. And if something feels off, we dig deeper with imaging and lab tests. Now, one thing that really stands out is how managing back pain isn't a one-man show. It takes an interprofessional team. Your primary care provider kicks things off with the initial history and exam. Nurses help reinforce the education, like the importance of staying active and the dangers of smoking. Pharmacists come in to make sure you're taking your medications right, whether it's those NSAIDs or muscle relaxants. And let's not forget the physical therapists, occupational therapists, and even nutritionists, especially if obesity is playing a role. I mean, sometimes I think our back pain is just our body's way of screaming, hey, maybe it's time to hit the gym and cut back on the pizza. After all that, when you do need surgery, or even if you're just recovering from an injury, rehabilitation is key. Techniques like the McKenzie method have been shown to be super helpful. Manual therapy, trunk strengthening, and progressive endurance exercises can make a huge difference. And for those of you in physically demanding jobs, occupational therapy can help you learn better ways to move and lift, reducing the risk of further injury. It's all about a tailored approach that fits your specific situation. Finally, let's talk about what you can do to keep that back in top shape. Patient education isn't just for the doctors. It's for you too. Staying active, avoiding prolonged sitting, proper lifting techniques, and even managing your weight can make a huge difference. For our younger listeners, remember, your backpack shouldn't weigh more than 10 to 20% of your body weight. And for everyone, quitting smoking is a no-brainer. All these lifestyle changes might seem small, but trust me, they add up to a big difference in quality of life. Wow, what a ride! Today, we unpacked the whole back pain universe, from causes and red flags to a comprehensive management plan that covers everything from NSAIDs, like ibuprofen, 400 to 600 milligrams every few hours, to muscle relaxants like cyclobenzaprine at 5 to 10 milligrams, and even second-line options like duloxetine for chronic pain. We broke down the differences between adult and pediatric back pain and emphasized the importance of teamwork among healthcare providers. So if you or someone you know is struggling with back pain, remember, there's a lot going on behind that ache and a whole team ready to help you get back on track. I'd love to hear your thoughts. Drop a comment, hit that like button, and if you haven't already, subscribe to Shock Doc Medical for more in-depth, no-nonsense discussions about your health. Next week, we're tackling another groundbreaking topic that might just change the way you think about chronic pain management. Until then, stay curious, stay active, and take good care of that back of yours. This is Dr. Rod signing off. Catch you on the next episode. And remember, folks, knowledge is power, especially when it comes to keeping your body in peak condition. Thanks for listening to Shock Doc Medical.